Good morning, welcome to our clinic. My name is Faizan and I will be your genetic counselor for today's session. May I know your names?
Yes, I am Romeo and this is my wife, Julia.
Okay, may I know where you came from?
We are from Semarang,
Okay, and how old are you?
I am 40 years old.
and I'm 38.
And may I know your educational background?
Yes, I'm in a bachelor level.
I finished high school.
Okay, how can I help you?
Yeah, so we got a referral letter from a pediatric endocrinologist. She said that we need to go to genetic counselor because she said that our daughter has some kind genetic condition.
So, can you tell me more about your daughter? What is her name?
Her name is Sabrina and she is 2 years old.
Okay, and can you tell me about her symptoms?
So she has a frequent seizures. Actually, the first seizures was on 5 months old, right? Yeah, 5 months old.
She was little.
Yeah, but the attacks still coming like 2 until 4 attacks per month.
Okay, and beside the seizure, does she have any other symptoms?
One that worries us much is actually the seizure, but lately she's been frequently sick. She had frequent flu, and also last month she was hospitalized due to diarrhea, and it's pretty bad, I think.
Okay, so can you tell me about your pregnancy time? How was it and how was the delivery?
It was an uncomplicated pregnancy. It's a full 9-month pregnancy.
Okay,
We routinely check to the OBGYN, and the doctor said that, yeah, pregnancy is cool. There's
and
nothing to worry.
okay, and how about the delivery? Was it normal?
Yes, it's spontaneous delivery, no C-section or anything.
And
My child was born normal.
okay,
She
and
cried immediately.
okay. How old were you when you got pregnant with your child?
I think it's pretty old, like 36 years.
Okay, can you tell me about your daughter speaking skills?
Well, she only speaks 2 to 3 words in a sentence.
And does she have any friends that she play with?
Yeah, she has many friends. I think she's fine with socializing, but her speaking skills is a bit late when compared to her peers.
And how about she can walk properly or run?
She cannot walk independently, right?
Yeah, she still cannot walk independently.
Okay.
She still needs some assistance.
So I want to ask you that is there any person in your family that has the same condition with your daughter?
My family is no. She's only our only daughter.
Yeah, me too. I don't think there is any family member in my big family who has similar condition with our daughter.
Okay. So now I will draw your family pedigree. Is it okay?
Yeah.
Okay. Is this your first marriage? And do you have any siblings of your daughter?
Yes, it is our first marriage, and she doesn't have any siblings.
Okay. From the paternal side, do you have any siblings?
Yes, I have 2 older sisters.
And have they married?
Yeah, both of them have married and each have 1 healthy son.
And what about your parents? Are they still alive?
Yeah, they're still alive.
Okay. And then from the maternal side, do you have any siblings?
Yes, I have 1 older brother and 2 younger sisters. I'm the second child.
And are they already married?
My brother is married with 2 sons, and they're both healthy. My
Alright.
sister is married with a healthy daughter, and my younger sister is not married yet.
Alright. And about your parents, are they still alive?
Yes, they're still alive.
Okay. Do you have any blood relation with each other?
No, we don't. I'm from Solo while my wife is from Semarang.
Okay. Can you tell me about your daughter vaccination status?
It's complete, I think. I routinely bring her to pediatrician.
And may I know your daughter height and weight?
Her last body weight was 14 kilograms, right? And also her last body height was 92 centimeters. I think our pediatrician wrote it in this additional studies report.
Okay. Yeah.
The child's nutritional status shows her weight for HC score is 1.56 standard deviation, weight for HC score is 1.94 standard deviation, and weight for HC score is 0.7 standard deviation, all within normal limit.
Okay, the facial features shows the child has small jaw small upper lip and mouth, down slanting eyelids, and low set of ears.
And for the additional studies, there were blood laboratory that showed hypothyroidism, while echocardiography displayed a ventricular septal defect, and the encephalography showed no epileptogenic wave with no slowing wave.
So I think it's enough for today's session, and I will discuss this with Dr. Astrid, and she will guide you about the next genetic testing in the next session.
Okay, thank you so much, Doctor.
Yeah, thank you so much.
Thank you for coming here, and see you soon.
Welcome again to our clinic. My name is Dr. Astrid. I think Dr. Faizan has already introduced me to you. Yeah, I already talked with Dr. Faizan and we discussed it with our team, and I'm here to explain about your daughter condition and what will need to be done to your daughter. So, we discussed and we suspect that your daughter has DiGeorge syndrome. It's some kind of genetic condition in which there is an abnormality in your daughter's chromosome. So we suspect it because your daughter has typical complaints and her facial dysmorphism, such as frequent infection. She also has congenital heart defects, and also her facial characteristic is typical, such as low-set ears. But due to the overlapping clinical characteristics with other syndromes, such as Alagille syndrome, CHART syndrome, and Kabuki syndrome, we need to do further testing, which is genetic testing, to confirm diagnosis.
So, what type of test will be done to confirm this disease?
Because we suspect it to be DiGeorge syndrome, it is a deletion. So a chromosome, a human chromosome, is normally 46 chromosome, but there is a structural abnormality in which there is a deletion in DiGeorge syndrome, and it's a really small deletion that cannot be detected using a common laboratory test. So we need to do the microarray test to detect the really small deletion of the chromosome. Chromosome is some kind of genetic material in all humans.
Okay, so what is the test?
It's microarray.
The microarray. So how do you do the test? I mean, should we collect our blood or something?
Yeah, we just need to collect your daughter's blood and then send it to the laboratory, and then they will do the testing.
Okay, as it's the genetic test, so do we as a parent also need to do this test?
No, it's for your daughter first, because I suspect it to be a de novo mutation, and almost all cases of DiGeorge is de novo, which means that it only occurs in that certain person, and also because you have no other family member with the same condition.
Okay.
Okay, so you gonna test our daughter because you suspect that the abnormality is only happening our daughter.
Yeah.
So how much does it cost for the test?
It's actually a bit expensive. It's around 8 million rupiahs for one person.
For one person?
Yes.
And beside this test, are there any other tests?
Yeah, actually there is other tests called FISH, fluorescent in situ hybridization, that can detect that the tiny deletion. But compared to microarray, this test that I'm explaining to you, microarray, is a better testing because it yields a higher diagnostic result, because it can detect a pathogenic abnormality that cannot be detected using FISH. So it's more specific.
Precise?
Yeah, it's more precise. Yeah, it's more
Okay,
precise.
and it's also expensive than the fish.
Yeah, it's
So
more
we
expensive.
will discuss it and give you which one we want to do for the.
It's okay. You can take as much as time you need it, and then after you've done discussing, you can let me know. Or if you have any other question, you can ask me.
Okay.
Oh, sorry. May I know how long the test result will come out?
It's around 1 month, but it can take longer. Depends on how loaded our laboratory is.
Oh, okay. I think it's fine. We can just do the test for our daughter first.
Yeah. So I think the microarray is the best option.
Yes, it will.
Okay.
So we have our decision. So we want to take the microarray test for our daughter.
So because you have made decision, I need you to sign this informed consent form. You can fill your identity here as the parents, and your daughter's identity here. Then you can sign here, and you can sign beside.
Okay.
Okay. So thank you again. We will notify you when the result is done, and then we will begin our next session, post-test session.
Thank you, doctor.
Thank you, Doctor. Good morning, Mr. Romeo and Mrs. Juliet. I'm Dr. Divina
Good morning.
as your genetic counselor for today. So we're gonna discuss more about your daughter's condition, the genetic results, and furthermore. So I think you already heard about the suspicion of DiGeorge syndrome of your daughter before, right? With
Yes.
Dr. Astrid.
Yes, we've already heard about DiGeorge, but we don't know much about it.
Yeah.
All right, so we already have the microarray results, and yeah, I'm gonna explain to you a bit. I know it's kind of complicated, but I will try to explain to you slowly. Yeah.
Okay.
Okay, so in our human body, normally we have 22 pairs of chromosomes and also one pair of chromosome sets. So we normally have 46 chromosomes like this, which is it is a diagram of the normal human chromosome. Each chromosome carries a certain inheritance trait in a gene. So that's why we call it, we need to do the genetic testing. So in your children, there is a problem in the chromosome 22, which is the microarray results that there is the deletion or there is a missing piece of your daughter's chromosome 22. So the chromosome 22 normally have two arms. There is short arms and also long arms. But here there is a small region in the long arms that is missed. That so your daughter have no this specific region, and unfortunately, the specific region covers several genes that are essential for several regulation, activities, development of the normal human body. Therefore, it can explain why your daughter have several symptoms and signs like frequent seizures, frequent infection, and then developmental delay, and also cardiac abnormality like congenital heart deformity that you probably have known from your pediatrician. So far, do you understand about the result here?
Yeah. So does our daughter really have this disease?
Yes, so this result confirmed that your daughter have DiGeorge syndrome, which is caused by the microdeletion or the missing piece of the chromosome 22 in your daughter's chromosome.
So what caused this disease? Because as we look ourselves, we are absolutely normal.
Yeah, we don't have any complaints.
Yeah.
Yes, I do understand that this is the most common question coming from the parents that have their daughter with or son with a certain genetic condition. So, based on the recent studies, the most common causes of this disease is actually like a random error, or we usually call it like de novo. So, normally, when the father have the sperm cell and the mother have egg cell, each of them will do the cell division. But sometimes there is a random error in either your sperm cell or your egg cell. We never know because it is just randomly like a recommendation error during the cell division that cause the missing piece of that small region in the chromosome 22. So I can say it's like an unfortunate event that present in your children. But there's also studies stated that around 10% of DiGeorge syndrome patients is actually inherited from their parents. It meaning that one of the parents carry the deleted part of the chromosome with microdeletion, and the parents that carry the microdeletion can inherit to their children with 50% chance of race. So that's why I recommend you to do the genetic testing as well as the same like your children did to confirm if one of you have also carried the deleted the chromosome with microdeletion.
So if we were to have another children, we need to do the testing first because you suspect us that we have what kind of small mutation or something.
Yeah, I actually recommend you if you want to have another child to do the genetic testing, just like your children, to confirm if one of you have the chromosome 22 with the microdeletion as well as like your children does. Because if one of you have the abnormal chromosome, it has 50% chance of risk to inherit to your offspring. That means that to sibling of the daughter, it can have 50% of chance to have the same condition. But the condition is very highly variable because it can be inherited from you if you have the chromosome with the microdeletion, but it can also possible if your daughter that just have the de novo mutation or just a random error, so it will not affect to the next sibling.
Okay, is this disease treatable? How can we treat it?
Yes, unfortunately for current recommendation, there is no definitive treatment to treat the chromosome with microdeletion. But in this case, there are several measures that can be taken for monitor and to treat to manage the current condition. I can give you the recommended supervision and treatment that they usually involve many specialized, which we call it multidisciplinary team, involving like the pediatrician, endocrinologist, and then the cardiologist, the neurologist, the ENT, musculoskeletal, and also psychology developmental. So you will need long-term monitoring and treatment for your daughter that involving quite many specialists.
So because it involves multidisciplinary team, we want to support our daughter as much as
Yeah.
possible. So what next step do we have to do?
Well, so for now, I recommend you to have a continuous follow-up with your specialist, as I told you before, which your pediatrician might help you to lead when you can control your daughter to come to their clinics, as well as you can also keep contact with us to do the continuous genetic counseling, because your children is still quite young. It's only 2 years old, right? So we still have a lot to be done with your children.
And if our daughter in the future want to get married and have children, does this disease will affect that?
I think it is recommended for us to do the close-up monitor and treatment for the current condition, because as I told you before, your daughter is still very young. She is only 2 years old,
Yeah.
so it means that she still have a long way to go. But in some cases, patients with DiGeorge syndrome, it is possible for them to marry someone and to get pregnant once they have treated all the conditions since they were young. But yeah, again, as I told you before, that since your daughter has already confirmed that she has the chromosome 22 with microdeletion, so she will have 50% chance of risk to inherit the deletion to her children too.
So as you explained before, can we prevent this disease to occur in our next child?
Yeah, some recommendations say that you can do the prenatal testing, but I think it is quite difficult to be done here, and the specificity and sensitivity of the test is quite low. And also, some also recommend to do the ultrasound testing when you are pregnant to detect like several abnormalities like the cleft lip and palate. Yeah, can sometimes be detected through the USG or ultrasonography. But again, the specificity and sensitivity is still low. So what I can recommend to you now is to do the parental examination to confirm if one of you have the deletion.
Okay, thank you so much, doctor, for
Yeah, thank
your input to this case.
Yeah, I hope you will have a strong faith to guide your children, and hopefully she can be treated right away and can have a long way to go.
Yeah, it's really difficult for us, but we're glad that you're our counselor and you give us the best explanation. So thank you so much.
You're
Thank you.
welcome. You can come in.